From University of Utah Health and The Scope Presents, I'm Mitch Sears, and this is Clinical. Throughout March and April of 2020, there was a ritual in New York City. When the city saw the very worst brunt of the COVID-19 pandemic, every night at 7 p.m., New Yorkers would open up their windows to clap and cheer for the healthcare workers that were risking their lives on the front lines. Throughout the United States, there were similar outpourings of support for medical workers. Billboards were plastered with photos of nurses and doctors wearing N95 masks. In Utah, community members started wearing white ribbons and placing signs in their front yard. Parades of police cars and fire trucks drove by the hospital with lights and sirens blaring to show their support. It's easy to support the abstract idea of a hero on the front lines, to wear a pin and clap and feel a sense of pride and gratitude. But the term frontline should not be taken lightly. For the medical staff risking infection daily, this pandemic is very much a war zone. Clinical co-producer Stephen Dark was given the opportunity to speak with 7 medical professionals about what it's like to work in the unit that is treating the very sickest of this pandemic's victims. This is Unit on the Brink, Voices from the COVID Frontline, a multi-part podcast series that offers a snapshot of one state, one hospital, one medical ICU during the very first months of the pandemic. This is not only the story of the pandemic itself, but also the lives of the men and women fighting to hold the line against the novel coronavirus. A raw look at what a group of healers treating COVID-19 positive patients face every day in the battle against the deadly virus.
Coding patients, doing CPR and, working frantically to try and save these patients' lives. And you're in, gowned up in this PPE with N95 masks on, and you're hot and it's exhausting. Well, after about 20 seconds, it feels like you've been doing it for 2 minutes. And you look up at the clock and you realize it's only been 20 seconds and you've still got to go for quite a bit longer.
This is the story of 6 medical professionals who know better than anyone else the cost of infection.
Because there are people that are fine. People come in and they're on a little bit of oxygen for a little while, they go to the floor, they go home. And the other side of that is seeing these people that are so sick and likely won't live.
Normally I would hug, a spouse who's crying or at least reach out and touch their shoulder or, it's just so bizarre to not be able to do that.
And I felt helpless at the doorway, yelling at this guy to stop. Because normally you go in there, you just go to your patient when they're having a hard time, but instead I froze at the door, and there's this big push you're first, you don't put yourself at risk, that's not what you do. But I couldn't stand at the doorway and watch him pull out his ECMO.
It's a battle. It's a battle between wanting to care and wanting to help and wanting to protect yourself and the people that you love and care about.
But we don't allow them to touch her because we don't know. We try to protect her more than anybody else. Yeah, because we don't know. This is really, some people don't realize how sick this disease is.
Change my clothes before I leave work. I go straight to the laundry. I strip to naked and wash my scrubs, and then I Clorox wipe everything that I've touched on the way to the shower. And so that's how I come home from work now.
Who daily battle the consequences of a virus to defenseless, sometimes dying patients, while some in the world beyond the hospital's walls even question the virus's existence.
It baffles me that people don't think that this is really happening.
You have no idea, and you can't know because you're not in it.
These 6 people were among the many at University Hospital who in those first days of the pandemic awaited the challenges of treating seriously ill COVID-19 positive patients.
Right, I think the patient must be very frightened because they have a tube in their mouth, they can't speak, and all they can see are our eyes, which the helmet on, the hood, and the occlusive mask and the occlusive gown. They must be very frightening and isolating.
Their stories offer a snapshot of the virus bearing down on one state, one group of medical professionals united in their sense of a calling, even to the point of risking their own lives.
I chose nursing because I wanted to be a public servant in a lot of ways. I think helping people that are in need and hopefully helping the greater good.
Being a nurse, like that, like loving, like I got you, girl, like that look, like they made it like okay, these nurses. Because I was like, you guys, like I told them what happened, and they're like, we got you, you're okay. It was so weird.
We're kind of like, this sounds cheesy to say, but almost like the special forces of this. We practice this all the time. We're very good at it. We're the experts at it.
Subscribe now so you can be notified when Unit on the Brink debuts this August. Just search Clinical wherever you listen to your podcasts or visit thescoperadio.com/clinicalpodcast.